Hello everyone, my name is Hashemi Rafsan Jami. I'm very much delighted to share my today's presentation with you guys. So let's move into the first slide. So the Abbott Freestyle Laboratory is one of the most successful continuous glucose monitoring CGM system worldwide, known as compact design. 14 days wear, seamless connectivity with smartphone. But the device's growth is being stunned by growing competition with Dexcom, and the market is growing fast but not evenly. Personalized data for continuous glucose monitoring is least likely to be on the arm, black, and hypnosis adults who are disproportionately affected by type 2 diabetics and low-income adults with type 2 diabetics. This plan suggests Abbott should be rethinking the brand's approach that in underserved Medicaid and communicate health population as the biggest growth opportunity has its rather than a CSR footnote. Abbott can transform long unmet access need into a sustained competitive edge with a combination of access channels, culturally relevant promotion, and a regimented approach to pricing and advocacy while the company continues to pursue growth through premium customers, tech and wellness customers, and pricey new offerings. Freestyle Laboratory is a CGM that eliminates that need for repetitive finger stick testing and instead features a tiny sensor that placed on upper arm that sends continuous glucose data to a smartphone every minute. Abbott's marketing strategy since it went to market in the United States has focused three angles: accuracy, size, and cost effective relative to the other competing system, which gave Abbott a jump start competing sensor Dexcom G7 system when it launched first on 2022. The sentence proved a success one. Abbott maintains is its edge in the CGM market in terms of unit volume. Meanwhile, Dexcom has focused on lower cost device more suited to type 2 diabetics patients because they offer the highest real-time accuracy insulin pump integration, according to the Future Market Insights 2026. According to the Grand View research, the growth of diabetics and growing coverage of diabetics reimbursement in the US, EU, and Japan are expected to be the key factor driving the global CGM device market during the forecast period, growing from valuation of approximately $13.4 billion in 2025 to reach $15.5 billion during 2026 alone. On an even optimistic note, the CGM market is projected to almost double in the US by 2023. Nevertheless, Freestyle Laboratory has its own weakness. The insulin pump segment is less robust than Dexcom's. Patients without strong insurance are still unable to afford it, and the Dexcom over-the-counter sensor Stelo has started to lure health-conscious non-diabetics wellness consumer away from Abbott's adjacent Lingo offering. The biggest and the most unacknowledged vulnerability is the lack of distributionals. Abbott's marketing is historically been aimed the same population which commercially uninsured and medical enrolled adults with type 2 diabetes remains underrepresented. IDF estimated that diabetes will affect estimated 463 million adults globally today, and that they by 2045 the number of people with diabetes will increase by 51% to 700 million, with the highest increase occurring by similar population with the lowest expected prevalence of CGM prescribed or filled. It is the time this plan is designed for. Multiple clinical policy studies demonstrate that uses of CGM is expanding, not contract health diabetes. A qualitative study of patients with type 2 diabetics enrolled in Medicaid who participated in program to obtain CGM federally qualified health center showed that meaningful improvements in the self-efficacy occurred when patient received the CGM, with more than half of the study patient being Hispanic and nearly fifth being black. However, CGM access was strongly linked to the location of care received. Overall, the data significant disparities in rates of technology uses by race, with patients with commercially paid insurance being more likely to have access to CGM device than those who Medicaid insurance, even though they have might the greatest need for technology use. Advocacy organizations and state Medicaid agencies are starting to take action. The American Diabetes Association is arguing state Medicaid program to change prescribed criteria and expand access to CGM beyond insulin and dependence individual and medicated technician assistance. Project is now working directly even with the states to increase medicated beneficiary to access CGM. Abbott has no current marketing that really has its own space, nor does Dexcom. The opening in this plan is to help that void first and foremost about strategy. Let's move this to the next slide. So the target retention. This plan is called for Abbott's marketing every effort to reach beyond traditional adult type 1 and type 2 diabetics and actively target medicated enrolled and uninsured adults with type 2 diabetics, especially those who treated at federally qualified health center, community health system, and safety net clinics, with particular focus on Black and Hispanic communities, where the rates of diabetes and its complications are highest. It is not the same commercially insured caregivers growth market that Abbott's currently targeted. It is another growth market that addictive without being the direct market targeted by Adopt or Dexcom. It is the biggest population not yet fully tapped into and growing target by state policy presence, Abbott with relatively safe growth avenue that doesn't have to stand toe to toe out with Dexcom premium heavy tech brand strategy. Next slide is like the marketing objectives. This plan has like measurable goals for the next 12 months. First, expand use of new continuous glucose monitoring device for type 2 diabetes patients who are covered by Medicaid by 25% in 5 pilot states. First, with 5 pilot states, increased access to the new CGM device for Medicaid covered type 2 diabetes patients by 25%. Second, increase 20% the number of Black and Hispanic diabetes community number who trusted are aware of Freestyle Libre 3 as compared to the general marketing plan. Third, expand coverage policy for CGM at least 3 more state medicated program via organization advocacy relationship. Fourth, and again consistency with Abbott overall objective increase on the balance of new patient enrollment by 15% for the equity component, at least significant proportion of increase, just not a side project. Let's move into the marketing strategy. The product Abbott should not be introduced a new device, rather the libre access of the existing devices. It is the same hardware but a new experience optimized for a new population. The simplified app that available in Spanish, other high demand languages, and SMS glucose alert has vast majority of CGM market doesn't mention the problem of having reliable smartphone data plan for undiversed patient. Community pharmacists would be trained, incentivized to support patients who receive a prescription with QoS in person at the time of pickup, as well as onboarding support to help the prevent drop-off of QoS after prescription is dispensed but never activated. Price, Abbott shouldn't establish national insurance partnership but also introduce a Libre for All co-pay assistance fund that can be directly managed by federally qualified health center, while also trying cash pricing to income for uninsured patients. Intent with the Abbott's account effort, the Abbott's policy team should seek bundle reimbursement pilots in the organization in the 5 targeted states, continuing the momentum and the advocacy efforts to expand medicated CGM coverage. A community healthy fair distribution of free starter sensor would allow the patient to see the value of product prior to the commitment of cost. Place distribution need placed beyond pharmacists and physician referrals to the mobile diabetes clinic center community health worker visit program in collaboration with safety net system. More importantly, really first in this area, Abbott's need to sponsor the screening and education communities. The patient visit beyond before they see an endologist. In barbershop, beauty salon, and churches. These touch points are extension to the clinical touch point, provide an opportunity for the Abbots to connect with patients through messenger who the community adult trust. Promotion. Rather than the using traditional celebrity patient endorsement, Abbott should hire trained patients advocated from community served, often referred as promoters in the Hispanic community health field who shared the lived experience and language of communities. As opposed to the national ad campaign, these ambassadors, with the aid of micro-influencer content creators already within diabetes patient communities, instead of celebrities with wide reach, can transport culturally specific content with multiple language that national campaign cannot. Free screening would be brought to underserved neighborhood term to take a control mobile education with hands-on device demonstration. Lastly, Abbott's healthcare providers education offering needs to be updated to help primary caregiver to at community clinic. The American Diabetes Association latest guidance on providing CGM to adults within type 2 diabetes who are taking insulin medications. Finally, Abbott's education initiative for health providers should take primary care providers at community clinic through American Diabetes Association at least let's glance offering CGM to adults with type 2 diabetes non-insulin therapy, creating a referral chain that leads to a prescription. So let's move on to the next slide is budget allocation. The plan suggests a 12-month budget splits for pilot over the following categories. 35% of community based on distribution, mobile clinics and CHWP partnership. 30% for multilingual digital content, patient ambassador program and grassroots promotional events. 20% for the cosplay assistant funding and sliding the scale pricing infrastructure, and 15% for the healthcare provider education and medicated policy advocacy. The idea behind this allocation to move spend from more generic digital advertising channel that Abbott has already utilizing in its marketing, while now the channel the and vehicles it believes to the real constant to the growth. So the implementation timeline you can see in the graph and charts. The implementation timeline will be like this, is gradual but rolled over like 12 months. In month 1 through 3, Abbott choose 5 pilot states with medicated CGM coverage gaps and diabetes prevalent, and completes working up partnership with federally qualified health center that produce translated app for education materials. For the month 4 and 6, it is all about community launch event, pharmacist training, first round of patient ambassador. Each pilot state focuses healthcare provider engagement and formal medicated managed care advocacy during months 7 or 9. Year 2 is spent on the year-end review of pilot results, fine-tuning the model based on the earlier results of pilot enrollment retention, and developing the business case of upscaling successful state across the country. In year 2, success will be measured in quarterly using series of equity specific metrics. In addition, Abbott's traditional commercial measures these includes patients endorsement and medicated population and uninsured population each pilot state. Prescription to fill conversation rate at partner clinics and pharmacies, 30 days and 90 days rates of sensor recorder retention, brand trusted scores, and brand awareness score. All this measurement and demonstrates that campaign success driving units and in successfully narrowing the access gap it's aimed to close. Let's move into the next slide. So the Freestyle Laboratory is already clinically strong, well-designed product in increasing market segmentation, has already battling for many years same patient that Dexcom is trying to capture in its marketing effort. Better long-term prospects for 10 of million M medicated patient is uninsured adults type 2 diabetes who are most in need of continuous glucose data have the least access to it. Abbott can create a true competitive moat form on an ongoing equity challenge by reshaping the product experience for connectivity and language, rethink pricing around community-based assistance, introducing trusted neighbor spaces and eliminate traditional celebrities branding and replacing it with peer-based ambassador and provider education. It's not taking that audience away from Abbott or replacing it. It is creating a second strong engine from the where it has been always left, where the clinical evidence and the market data indicates it's there. So thank you all. These are the references I use for my presentation. I hope you understand well everything. If there is any question, please let me know down in the comment section. Thank you. Thank you, everyone.